The person-centered framework was developed by McCormick and McCants in 2006 and was derived from previous research conducted on the elderly and the experience of caring when in the nursing profession. The framework consists of 4 elements: being professionally competent, developing interpersonal skills, being committed to the job, and demonstrating clarity, beliefs, and values, and also knowing oneself. Person-centered care is a philosophical approach to service development and service delivery that sees services provided in a way that is respectful of and responsive to the preferences, needs, and values of people and those who care for them. The perceptions of PCC are recognised when nurses know the unique characteristics of the patient they are caring for and understand what is important to them and act accordingly. Being professionally competent is described as the knowledge and the skills of the nurse to make decisions and prioritise their care. It includes competence in relation to physical or technical aspects of care. It is more than just an action that reflects a holistic approach. It includes knowledge, skills, and attitudes rather than just completing a task or having the behaviour that is expected. Professional competency is achieved by continuous training during your career and attending mandatory training. An example of professional competence when it comes to triage in A&E would be having an experienced registered nurse who has an extensive knowledge of all components of health, controlling the triage process to ensure patients are seen accordingly. Nursing is a social practice, and nurses need to be socially competent. They must possess the skills in building therapeutic relationships and hold interpersonal communication skills to collect subjective and objective data for health assessments. By being empathetic, nurses listen and understand the patient's experience to help them resolve their health issues. Nurses should maintain working within their code of conduct. For example, prescribing medication is out of their practice. By effectively listening to the patient and maintaining eye contact, we can improve the level of healthcare. Nurses can paraphrase sentences if the patient cannot understand because of any language barriers. Exploration is required for checking the patient's health by asking open-ended and enabling questions. Difficult patients can allow the health assessment to become distressing, so the nurse should handle aggressive patients with teamwork. Services were developed to reduce preventable admissions of people who visit the A&E with uncertain discharge or admit by assessing geriatric-specific non-acute care. Merriam-Webster Dictionary defines professionalism as the conduct, aims, or qualities that characterize or mark a professional person. People recognize professionalism through observation. The healthcare profession expects its professionals to maintain important values that have positive impacts on the medical field, as viewed by patients and other professionals. Healthcare professionals should be ethical, compassionate, and fully committed to providing patient-centered care. Commitment to the job, as explained by McCormick and McCants, is more than going the extra mile and beyond expectations of nurses. It is one of the most important factors contributing to a successful healthcare career. Healthcare involves many personal interactions with a variety of people. Being committed to the job is more than just having good manners. Commitment is reflected through the actions and culture of the team and the healthcare system. Being committed to the job at its most fundamental level reflects dedication and a sense that the nurse wants to provide high-quality patient care. When working within a team environment, nurses share their own beliefs and values so that they can work towards a shared vision of person-centered care. Additional attributes that make up commitment include respect, responsiveness, providing the needs and values to patients, as well as showing support emotionally and physically, sharing information and communicating, and giving an access of healthcare. Commitment is a complex and multifaceted construct and can take different forms. The success or failure of an organization is closely related to the effort and motivation of its employees. Commitment to the job is important for triaging, as nurses must be committed in order to provide a high level of person-centered care. It is highly significant for a healthcare professional to be able to work with and respect patients' beliefs and values. It is important we become aware of our own beliefs, values, and attitudes to recognize how these factors may impact in the way which we communicate with other health professionals, clients, families, and also the community. This ties into the moral and ethical codes which we must abide by in our nursing practice. We must understand the concept of knowing self and the underpinning attitude before we are able to help others. We must discover how we think and behave first. Our personal identity can influence the way we perceive the world and how we work within the healthcare system. We need to find out how we can manage attitudes in order to work efficiently and provide a psychologically safe environment for the patient. Cultural competence ties into this idea of respecting each other's beliefs and values because as individuals, we must treat patients with empathy, dignity, respect, and fairness to fulfill person-centered care. It is important we are able to learn skills needed to perform cultural assessment in order to plan, implement, and review safe cultural practice. When elevating the triaging process in a healthcare environment, it is important that stereotypes and discrimination are not present. This process must be looked at in a holistic way. It must be fair and honest to ensure patients get the required treatment that they need. Person-centered care represents how actions of health professionals affect nursing support, as well as providing stability towards the entire triaging process within the emergency department of any hospital. This includes training strategies and programs that ensure nurses are competent and have the required skill set to be able to properly triage patients and provide a groundwork of interpersonal skills and being socially competent, thus including proficiency of respecting cultural ties, beliefs, values, and safeties in individuals, providing dignity and respect in the treatment and care that we deliver. Nurses must go the extra mile to commit themselves through actions and culture of the team and healthcare systems to remit higher quality patient care and treatment levels. To be able to nurse efficiently within the triaging, we need to fathom the notion of knowing oneself so we can treat and care for others whilst understanding our own behavioural attributes first. When examining the skill set of each nurse and their competency to be able to triage, they must adopt certain personal and professional skills. These include being open-minded, respectful of different cultures and values, using self-professional judgment, triaging protocols, and critical thinking to ensure there is a protected equality of judgment and protocol. These prerequisites allow triaging to operate and perform readily and with ease, enabling patients to be prioritised, overall bettering the health outcomes of patients.